The United States is the only large high-income nation that does not provide universal health care to its citizens. The United States maintains a lucrative for-profit system. For the last handful of decades, thousands of deaths could have been prevented. The consequences of the COVID-19 pandemic reveal the contradictions of the U.S. medical system, with an estimated 338,000 COVID-19 related deaths due to workers limited by or prevented from receiving life-saving care due to private insurance restrictions or fear of crippling debt. Most, if not all, of those deaths could have been prevented with a Medicare for all system. We can contrast the data between a capitalist economy for-profit healthcare system with a socialist economic nationalized healthcare system to reveal those contradictions. The GDP of Cuba is $107 billion US, and the current infant mortality rate for Cuba in 2023 is 4.1 deaths per thousand live births. The GDP of the United States is $25.36 trillion, and the infant mortality rate is 5.4 deaths per thousand. Cuba spends just $813 per person annually on health care, compared with America's $9,403. In Cuba, health care is protected under the Constitution as a fundamental human right. The U.S. for-profit healthcare system generates a considerable amount of more in waste than Cuba does. The reality is that Medicare for all is the only solution that guarantees care for everyone in the U.S., brings down costs for working families, and generates savings for the country as a whole. The Medicare for all can create a more democratic healthcare system in which everyone, citizen and non-citizen, men, women, children, and the whole of the LGBTQ community and the elderly can be treated as needed without arbitrary barriers set up by insurance companies or fear of crippling debt. We can say goodbye to having to choose between feeding our children or taking our medications. Deaths can be prevented since those who need insulin, which can range in price from $50 to over $1,000, will be able to get without emptying their bank account or having to ration the dose. The for-profit system is only going to take care of the people that can pay for it. The more they can pay, the better the service. Most working people are not going to be able to pay for very good health, if any at all. A national healthcare system would cover everybody from the cradle to the grave. It would cover all expenses for medically necessary procedures, including dental, hearing, elder care, and vision. A national healthcare system would save the country hundreds of millions of dollars because it wouldn't be going to the waste of a for-profit system. It would save people individually a lot of money. The shareholders only care about the bottom line. They want maximum profit coming in and minimal amount of money going out. To the patients, this means less coverage, denial of claims, and then forcing patients into arbitration. The arguments against a Medicare for all system only exist because of big pharma, corporate owners, and shareholders are holding on to their greed. They are choosing profit over the people. The need for you to join the fight by calling your elected officials, joining organizations that support Medicare for all, getting in the street, and demanding the system change to put people over profit. Join the fight. Join your local Communist Party